Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
The most common modality of biofeedback training or therapy is electromyography. Because electromyography is able to record the activity of motor units of the muscles, if an individual is connected to a special instrument capable of displaying the electrical activity of a given muscle modified to some form of audio-visual signal, then it's possible to have the patient aware of his muscle activity under the skin. This kind of muscle sense can introduce the individual to a knowledge of his internal physiology, and he or she is better able to learn how to control the firing of motor units. As we can see, this approach is devoted to muscle control, since some emotional state is always together with some sort of muscle hyperactivity. Here, the psychosomatic aspect is stressed, where we cannot separate the soma from the psyche. EMG biofeedback has been introduced to dentistry for no more than a decade, and sometimes the enthusiasm of the users is so great that they advise its use in substitution for other types of therapy in the treatment of masticatory system dysfunctions. Anyhow, this idea must be regarded with some limitations. Considering the major clinical uses in electromyography biofeedback, we have some points. The special one is general relaxation, where a psychosomatic approach can change the physiological state and is accompanied by an appropriate change in the mental emotional state of the patient. Then, training in body relaxation is an excellent way to promote an overall welfare for the patient. The other one is phobic desensitization, and this modality of training is especially useful to performers, for example, actors, sport players, musicians, and so on, who can experience some sort of phobia when facing an audience in tournaments or contests. As part of this clinical use, we have also anxiety reduction, where tension and anxiety, which originate in the level of psychological experience, convert into somatic disturbance. Then, biofeedback training can convey some kind of emotional relief, and this can be taken as one of the most important types of therapy. Another one is tension, headaches, neck and back pain. In the same fashion, the patient can be instructed to control the firing activity of the motor units, and such a way he is capable to quantify muscle contraction and relaxation. Another one is essential hypertension. Some kind of wrist-to-wrist or even ankle-to-ankle placement of the electrodes allows the use of a direct audio mode and have the patient reduce the sound sufficiently as to be able to detect heart rate in the audio signal. Another one, totally related to our profession, is bruxism and temporomandibular joint syndromes. In this aspect, the use of this kind of therapy is still in an experimental basis. Anyhow, this method can be useful in helping the patient to control bruxism habit with the use of portable units, and even in a clinical circumstance to reduce masticatory muscle hypertension. Another one is neuromuscular reeducation and stroke. In this way, this modality of treatment is used to increase muscle strength or for careful differentiation of muscle discharge within a functional movement or posture. Finally, one very important one, cerebral palsy. And this method is also indicated for exercise of weak and uncoordinated muscle activity, especially in cases of head positioning. With respect to the biofeedback loop, it's important to consider that the patient is in itself part of the treatment. So here we have in the figure the overall loop in electromyographic loop. First, we have the idea of the attachment of the electrodes on the masseter and the reference electrode on the mastoid process. Then the LEDs leave the impulses to the AC preamplifier. That is a circuit which changes a small signal into a large one. Is an initial circuit which is needed to amplify extremely small electrical signals for the amplifier. Then it goes to the amplifier that only amplify the difference between in its inputs. A signal which is common to the electrodes, unwanted, is for the most part eliminated. From this part we go to the high-pass filter that's useful to eliminate some artifacts as other muscle signals and to reduce the 60 cycles hum that may present in both electrodes input LEDs. The rectifier following is a part where the sinus wave is totally deflected in order to produce a continuous current. The integrator comes now and controls the total energy of the current over a given period of time. Then the signal goes to a dial where the therapist can control or observe the deflection of the needle, considering the amplitude of the activity of the muscle. And then part of this integrator signal goes to a feedback processor that transforms the signal into analog audible tone or into a binary or digital signal. For example, a visual sequence of lamps or LED numbers. In some instances, even an oscilloscope can be used. There are different models and makes of biofeedback units in electromyography. Here on my hand, we have one portable unit that can be used in dentistry to control bruxing habit. And the patient attaches the electrode here on his face, and the amplifier here is adjusted to receive some signals during sleep. Here we have another type of unit that can be used in the dental office, even a medical office. On the front part of this unit, we can see this dial that is the EMG activity meter that provides a visual display of the EMG activity in integral average microvolts, selectable over 6 scales from 0.05 microvolt to 1000 microvolt. When switched to the appropriate test mode, this meter also tests battery strength and electrode impedance, that is quality of electrode attachment. Here we have the meter. It's a meter function selector that selects the function which will be displayed by the meter at any given time. Then we have the switch for volume control that controls the volume of the audio feedback. Then we have the audio feedback threshold that sets the lower microvolt limit at which audio feedback is activated. And here we have the pulse and bitone mode in feedback. The pulse push button switch whether the selected audio feedback signal will be continuous or pulsating. The audio feedback selector here switch which audio feedback will be delivered. When not depressed, analog tone feedback is activated. When depressed, bitonal derivative feedback is activated. In this case, two separate tones will present a high-pitched tone, and then another one, a low-pitched tone. The high-pitched tone will appear when the activity in electromyography is increased, and the low-pitched tone will appear when the electromyography activity is decreased. The last part is the plug where we attach the electrodes. The picture depicts the position of the frontal muscles that has a classical use in electromyography biofeedback. It's a muscle very difficult to relax, so it has been used for quite a long time. And the arrow points the position of the active electrode on one side. On the other side, we put the other active electrode, and in between the muscles, we can attach the ground electrode. In our dental use, we can provide some relaxation for the masseter muscle, and the finger points the position where we can attach the active electrodes in the bulk of the muscle, and then the reference electrode can be placed on the mastoid process. Now we are going to demonstrate the placement for the electrodes on the right masseter for a biofeedback training. On the right side of the patient, clench please. First, we eliminate any kind of grease from the skin of the patient with alcohol, and then we are ready to place the adhesive collars. Clench again, position, relax and clench again. And then we apply some quantity of electrode paste. And we also apply some quantity of electrode paste on the electrodes. Okay. Another quantity on the other electrode, and it's ready to be applied to the patient face. Clench please. Hold it for a while in order to set. This must be careful done in order to get a very low impedance. Next, we are going to attach the ground electrode on the rear lobe. And apply some electrode paste. And this special kind of earring electrode. Next step is to check the quality of the battery. The first one's okay. The second one too. And then we check the impedance. Very low impedance. The other impedance. And then we select the meter scale, the type of electromyographic proportion we want in microvolts. Here we can control the volume, and here we can see the deflection of the needle according to the muscle activity of the patient. Clench, please. As you can see, there is a total deflection of the. As far as we decrease the proportion of this scale, it's more difficult for the patient to go into relaxation. And as far as we increase the proportion of the meter, it's very easy to the patient to go into relaxation. Or anyhow to decrease the tone of the biofeedback. Let's leave in number 1, and we ask the patient to clench please again. So we have this kind of continuous tone. Relax. We can also modify the kind of pulse. Clench, please. Relax now. Naturally, for this type of procedure, it's a good idea to use headphone instead of a speaker, because the patient can concentrate much better in with this kind of approach. And it's also wise to eliminate any kind of rest from the head of the patient, so he must be kept himself in a postural position to be capable to concentrate in his training. It seems a paradox, but the patient must concentrate to relax. So this is the analog type of tone, and we can produce even bitone. Squeeze, please. Relax. Squeeze, please. Relax. And even pulse. Squeeze, please. Relax. So that's the overall idea we can use to provide this kind of biofeedback training, where the patient is capable to hear the activity of his muscle.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.